Mitch McConnell has now delayed a vote on the Senate Republican health care bill until after the July 4th recess. What exactly this means for the future of the so-called Better Care Reconciliation Act is, at this point, unclear. But one thing is certain. In its current form, the Senate Republican health care bill is a death sentence for tens of thousands of Americans every year. In fact, a new study published in the Annals of Internal Medicine suggests that about 28,600 more people could die every year in the United States if the Senate health care bill becomes law. For more on the Republican Party's murderous health care bill, I'm joined now by Richard Wolff, visiting professor at the New School, co-founder of Democracy at Work, and the author of numerous books, including Capitalism's Crisis Deepens, Essays on the Global Economic Meltdown. Professor Richard Wolff, welcome back, sir.
Thank you, Tom. Glad to be here.
Great having you. What kind of ideology sacrifices the lives of tens of thousands of people to give massive tax cuts to the rich? How can anybody even dare to call this conservative? Isn't that a word that at one time had a decent name?
Yeah, it's not clear to me what exactly they are conserving here. I mean, what in the world would possess you to be the only country in the advanced part of the world, a wealthy country, that is unable and unwilling to do what all the other countries have done with the capacities we have, namely to say to every citizen, every human being, if you get sick for all of the diverse reasons that can happen to any one of us, we will make sure that you get adequate, good health care, that you are insured as a matter of your citizenship, just like you're insured to have a decent public education through high school, or to have access to public parks to recreate yourself. All of these things are parts of what a decent society would want to have and to conserve. They're not doing this. They are actually undoing the existing coverage for millions of American people, the poorest amongst us especially, taking away from them something they have. They're not conserving, they're destroying.
Yeah. So, single-payer health care, Medicare, Medicaid, these were progressive programs put forward by Democrats over the years. Single-payer health care, has not been realized as a vision in this nation, but that's kind of the liberal version of it. The conservative version of health care reform started in 1972 with Richard Nixon. Teddy Kennedy fought it and went down in flames, but it resurfaced in virtually identical form from the Heritage Foundation, as I recall, in 1986. That went on to become called Romney Care, Mitt Romney in Massachusetts, Republican health care program, and that was reinvented as Obamacare. So Obamacare actually is arguably the conservative version of health care reform. That's its lineage. If that's the case, what does that make this Senate plan?
It makes it a radical undoing of what was a kind of consensus. And it's important to make clear what it was. It was a consensus that just as Medicare provided to everyone over 65 a basic medical insurance program, this could and should be extended to the population as a whole. Medicaid was a halfway measure in that direction. And here comes the big part, it was to be paid for by a modest tax on the richest people amongst us, so as to make it as fair as possible. Those people, particularly in the last 40 years, have been the ones whose income has gone up the furthest, whose wealth has increased the most, and whose other taxes have been brought down. So it seemed the ultimate fair step. What the Republicans are doing now is going back on that consensus, depriving millions of people of medical care, and there's only one basic reason why they're doing it, and that is to relieve the tiny percentage of our population that was subject to the tax to pay for it from having to pay that tax. To reduce the taxes on already the richest people in order to save them from having to pay what they should have contributed all along, and what their counterparts in Europe, for example, do every day and have been doing for decades. It's inexcusable going backwards in our history rather than forwards.
Yeah, absolutely. How does the Republican healthcare plan even make sense from a macroeconomic point of view? Last time I checked, more people in medical debt means fewer people spending money and thus driving aggregate demand, which is what fuels economies.
Absolutely. You're going to impoverish large numbers of people. You're going to make them very, very vulnerable to any kind of medical adversity, which they will not now be able to handle if that bill goes through. The economic ramifications of that are incalculable. The amount of suffering and what that will do to families. And again, on the other side of the ledger, what's the positive? To reduce taxes for the very richest who already don't spend a good part of what they earn makes no sense. They're not going to spend it. They're going to send it off into whatever investment plans they have, or hoard it as cash, or invest it abroad. So yes, the macroeconomic implications of this are as damaging as are the human implications of this for millions of Americans. Again, the only winner in the GOP plan are the richest amongst us, who will not now have to pay the small tax that they did have to pay under the Obamacare plan. And that's why they are the supporters of the Republican Party, and why the leaders of the Republican Party are calculating that by getting all of those rich people on their side, they will get more political donations and be able to run a clever campaign in which they tell Americans all sorts of things to obscure this immoral and unethical thing they are in the midst of trying to get done.
Yeah. I knew Medicare was paid for out of the payroll tax, like with Social Security. I didn't realize that Medicaid was paid for exclusively or largely with the tax just on rich people. I know the expansion of Medicaid in Obamacare, was funded with a 3.8% increase in the capital gains tax.
That's all I meant.
Right,
yes.
Which was at 20%.
That's correct.
Okay, so this is why the billionaire class basically is pushing the Republican politicians that they own to basically, do something right in the face of their constituents. And I guess they're just assuming that the billionaires will back them up with millions of dollars in advertising for their elections or something if they do this?
Yes, and that they will be able to tell some sort of story that this has to do with a policy of medical care. It's got nothing to do with medical care. There are all kinds of problems in any national health insurance. You can see that all over the world. Those problems are the same kind of problems any large institution or large public program has, and they are solved over time by the diligent efforts of the people that are involved. The richest in America have reached the point where they're not satisfied with being the richest in America, but, and this slips out occasionally, they want to challenge the right of poor people to have a health care that will cover them if they get sick through no fault of their own. It is a level of self-serving behavior that ought to make most Americans step back and feel as though they don't want to be involved in all of this. But the Republicans have thrown their lot into this thing, and they're going to carry it through and hope that the money they get from the people whose taxes they've lowered will give them the resources to fudge the question and hold on to political power.
Amazing. As Republicans are pushing for this murderous tax cut / healthcare bill, Americans are literally dying increasingly as a result of opiate overdoses. Does this omnipresence of death in American society tell us anything about capitalism?
I think so. I think we're seeing that when the decision of capitalists was made, particularly back around the 1970s and 80s, for example, to move large amounts of production out of the United States to other countries where they could get away with paying much lower wages, to bring waves of immigrants in who can also be made to work at lower wages, to automate, to transform production, to get rid of jobs and replace them with computers and now with robots. all of this transformed the job realities. It didn't have to. There's plenty of work to be done in America that we can all point to. Rebuild our cities, give us the greening that we desperately need, take care of an aging population. We could have put people to work in jobs as interesting or better than what they had before, but we didn't. What we did is lay them off. What we did is stay them in a job, but take away the benefits, take away the extras, take away, make the job less secure. And then we're surprised, apparently, when if you deteriorate the quality of the job, if you take away the money that people had expected to earn, including those who studied for years to be prepared for this, we then seem to be surprised that those people get depressed, become dependent on mind-altering drugs, legal and illegal, commit suicide at new rates, get seriously involved in all kinds of escape mechanisms. Of course they do. We have taken a generation of Americans, told them that they would live better than the generations before them, teaching them now, and especially since 2008, that that's not true, that their job isn't going to be secure, and it isn't going to be well paid, and it isn't going to have good benefits, and then expect them somehow what? Not to react, not to feel disappointed, to feel betrayed? They do. And I'm not surprised that in the despair that comes with that, we begin to see signs of depression and death all around us. And we should see them as symptoms of an economic system that isn't working anymore, except for those at the top who want to buy the political system to keep it going this way. This is not acceptable. And in the medium run, not just the long run, I don't think the American people will tolerate it.
Yeah, this is Henry Wallace's nightmare. Richard Wolff,
right.
It's always a pleasure and an honor to have you on our program. Thanks so much for dropping by tonight.
Thanks, Tom. I appreciate it.
Thank you.